if you have a good source of data that is accurate, reliable, complete, standard-based, you're going to get more information that you can use to leverage your own decision-making and take it in new directions, right? So I think it all comes from the ability to automate the data collection and have more visibility of the data, and the data being able to flow from one silo to the other seamlessly, and being able to really generate a lot of benefits for all of those systems connected. I think this is really where the opportunity is.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we are going to be speaking with Arnold Chazal, CEO at VUEMED. We're going to be talking about connecting with clinicians and taking action, but more importantly, how do we get hospitals to adopt technologies for departments like supply chain to really create some operational efficiencies?
Hey, and Arnold's bringing it from worldwide. He's from France, and he's going to tell us everything about it here in just a second. So stick around, and you're going to have a great time.
All right, going global with Arnold. Stay with us. We'll be right back after a short break.
Boom! I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
We are speaking with Arnold Chazal, CEO at VUEMED, and we're going to be talking about connecting with clinicians and taking action today. So, Arnold, thanks so much for joining us here on the Power Supply podcast.
Thank you for inviting me.
We're excited to have you. Honestly, we are, Arnold. And first, obviously our listeners that are, all around the world are typically, they're not seeing what we see here. But today, you're not from the United States either. You're not here. Where are you?
Well, I'm based in France, but my company is headquartered in Seattle. So, a little bit of a global company here.
You absolutely
Just a short flight.
Yeah, 9 hours, 9.5 hours.
So needless to say, it's about 3:00 in the afternoon here while we record this, and it's like midnight over there. So we'll try to keep you awake.
Thank you.
Well, Arnold, why don't you tell us a little bit about your background, and obviously you're a world traveler. So even if you have something interesting from your travels or, differences in cultures, I'd love to hear it.
I don't know if I have very good stories to tell about my business travels. They are pretty horrible every single time. But I'll tell you that I'm a lawyer by training. I went into management consulting after law school, and then I saw an opportunity to improve hospitals' way of dealing with their supply chain and inventory management. And about 15 years ago, I started VUEMED, which is a software IT company that is focusing primarily in healthcare, in providing technologies that help hospitals manage their supply chain and inventory management in better ways.
Well, let's start talking about technology just to begin with, because, obviously, as you said, it's a software. So you're a technology company. And I would say sometimes the cycle on adopting technologies in hospitals can be really, really slow. And other times it can go faster. So maybe you can help us understand, from your experience, where have hospitals been really good at adopting technology? Like, where has that, been a success? Not only have they been able to adopt it quickly, but also successfully?
Yeah, no, it's a very interesting question because, hospitals have been really good at adopting technologies that are geared towards the benefits to the patient or the clinician. And I mean by that, adopting new medical devices, new treatment options. When it comes to really improving the operations of the hospital, this is not close to their core mission. And anything that has to do with material management, with clinical documentation, or even anything that is relating to business operations, have not been very good at adopting new technologies. And you see that in the fact that ERP systems have been very slow at being upgraded, that electronic medical records took a long time to be really implemented. And it's true now with supply chain technologies that are very slow to be adopted.
When you say slow, what does that mean to you, Arnold? Like, are we talking 6 months? Are we talking 2 years? Or what do you typically see?
Well, it's, slow means they are not really taking action. That's really how slow it is. When it came to adopting electronic health records, there was an incentive for a lot of hospitals to do so. And it took for most of them the last 15 years to get to it. Then they realized they had technologies to manage their orders and financial tools like an ERP system that were outdated. And so they needed to invest in that. So it's been a constant battle in the last maybe 20 years to bring hospitals from, I would say, a dark age in technology to where it needs to be. And we still have ways to go with supply chain in other areas, like how to fight cybersecurity or clinician feeling burnt out. Are there ways to improve all those things?
But when you agree to, Arnold, that a lot of that, it's not that health systems don't want better technology or don't need better technology, but they're just resource limited, right? They don't have the bandwidth to get people to, do all the interfaces and get it all done and put it on the priority list. And is that what you see a lot of that is? Yeah,
well, improving business operations is not their core competency. It's not core to their mission. It's treating patients, right? So it's not, a key element that they think about all the time. The other thing is to undertake a big project, such as implementing a new technology that is designed to improve the way hospitals are functioning, typically requires a lot of constituents. You're going to have clinical folks, your supply chain people, finance, IT, value analysis folks. You need leadership support, and you need the appropriate human and capital resources, which oftentimes is lacking. So it makes it more difficult for them to undertake a technology implementation, which is not geared toward their core mission.
And you named about 3 different things they have to have, and it's always hard to get all 3 or 4 of those things lined up at the same time.
Right. And, you see resistance because, a lot of the hurdles they face can be boiled down to a few things. There are cost objections. They need money. They have also competing priorities. You have so much to work with your budget. Do you invest in new treatment options, or do you put a new supply chain technology in place? There is also the problem that they are quite risk averse and often status quo driven, which makes taking a decision quite difficult at times. They also resist change typically, and they have a risk aversion. And finally, they lack the expertise in-house to really take the lead and do a good job running a project to optimize their supply chain or any other area where technology would be required.
We've had so many conversations about how healthcare organizations are demanding more from their suppliers. And that last element that you said, I think is really important is, can you provide the expertise to implement your technology so that doesn't require so much bandwidth on the hospital side to dedicate those resources, especially when, to your point, they're very resource starved. And supply chain has been incredibly resource starved. I mean, it's hard to make really informed and educated decisions when you don't have the data at your fingertips to help you guide strategy, right? And I think that's where, we see that operational types of technologies that would support supply chain could really push things forward. And you've said several times, technologies such as ones that would support supply chain are not connected directly to patient care. It's not core to their mission. I think during the pandemic, that has started to change. I realize that there may be a degree of separation there. We had a great interview last season with Lisa Farmer from Baptist Health in Arkansas, and she was talking about making sure that her staff had their own patient experience, because ultimately, they are also removed from that patient experience and may not realize how connected to the mission they are. I feel like leadership maybe is starting to see that. Have you noticed a change that supply chain is now seen a lot closer to that mission than they ever were in the past? And has that helped, in your opinion, with the adoption of supply chain technologies?
Yeah, no, definitely. Typically, I think, and historically, supply chain was never elevated to the C-suite level. It was some kind of function somewhere based in the basement of the hospital, close to the dock, receiving boxes and dispatching boxes. It had never been seen as a critical mission of the hospital to be running their operations, right? And then COVID happened, the pandemic that really broke down the supply chain totally. And then there was that realization that supply chain is really critical to the proper functioning of the hospital. And then they really took into consideration the fact that I think leadership realized that a lot of the issues that they find in the clinical areas that actually affect the patients and patient care stem from issues rooted in the supply chain. And that means anything from not knowing if you have the products that you need on hand, having products that have expired on your shelves, not knowing what has been recalled. All these issues that are supply chain related issues, really, at the end of the day, are impacting clinical work and are putting the patient at risk. So yes, there was this realization that, well, we cannot run this big machine that we have of a hospital. We cannot have all these beautiful robotic technologies to save patients, these new treatment options, and not have basically the technology behind to support the basics, which is supply chain. And you go to other industries, automobile industries, pharmaceutical industries, they've understood the strategic value of supply chain. In healthcare, it is only coming to the surface now, but there are good initiatives that are being taken. And I think they are seen as a more global view, not thinking about one department, but maybe an entire hospital system. So really understanding that it has to be standardized and it has to be elevated to a higher level of technology to be efficient.
Can you make a guess of where, hospitals, particularly in the United States, in some cases have really great technology. In others, they don't. There's a vacuum, there's a hole somewhere. If you'd had a guess, where do most systems don't do a good job in providing the right data at the right time, at the right place? Is there a place, is it the OR? Is it EP? Where is it that we need better data? Do you have a guess, and what would you think? How would you answer that?
Well, it's an interesting statement that you make, or question. Honestly, I think that the main problem is a lot of the technologies in place at hospitals, whether we are talking about material management information system, ERP system on one hand, on the other end of the spectrum, you have the clinical documentation systems, and they vary from EP, cath lab, interventional radiology, ORs, there are a multitude of systems, and then the electronic medical records. But all those two sides function as silos. So there's very poor communication. There is no integration. And the reality is supply chain and data from the supply chain sits right in the middle. So if you're looking at any system, even the most advanced hospitals, so I don't think I would want to go down to the level of individual departments, but really at the hospital level, they have typically still those silos. It may be more modern technologies, more up-to-date technologies, but they still don't speak to each other. So the data doesn't really flow. There is no standard between those systems. The integration is very rare. Interoperability doesn't really exist. And there's a great opportunity for a technology in supply chain to play that bridge, to break those silos and allows the data to flow from one end to the other, because this data is essential for the clinical work, but also for supply chain work.
Yeah, I'll throw another silo onto that farm, which is rev cycle and patient, all of the building practices. Supply chain still sits into the middle of that because of procurement functionalities as well. So I think you're entirely correct on that assessment. You mentioned value analysis earlier as kind of part of this picture. And we have seen, through that initiative really, that supply chain has become a little bit more clinically integrated. And there's actually a focus on clinical integration within supply chain across the country. Does that help get us across the line there where we were talking about supply chain being closer to the mission? Does clinical integration, by virtue of its function, pull supply chain closer and help us raise the level of importance of, sitting a solution that can support supply chain and start to connect those silos? Because it can't really break down the silos, right? The silos are built and they're integral to how everything functions, but you almost need, conveyor belts to pass the materials from one silo to another.
Yeah, you need a bridge. And what you see is supply chain and a technology in supply chain as the opportunity to not only provide full visibility and trackability, but also document usage of or availability of products so much more accurately. So for instance, when you're looking at the life cycle of a product, from point of entry to point of care, they are taken care of in the ERP system or material management information system as part of the purchase order. But then you lose visibility. And then they end up, in the clinical areas and they're being used. But this information is not necessarily returned back to the supply chain area. So there's it's very fragmented. There is no full visibility. There is no full data flowing and no full trackability. And this is what we need. We need that bridge to happen for those silos to really be broken and really start having a virtuous cycle.
So I feel like clinicians in the past have really been distrustful of the data. They're like, hey, this doesn't represent what we're doing every day or what we see every day. And I could say that because I worked as a nurse for many years. And, sometimes you're in the throes of things and you're delivering that patient care. I do think that that's been one of the reasons for having a clinically integrated supply chain, is to help make sure that that data translates in a way that the clinicians can relate to it and then begin to trust it. But can you talk about maybe some other reasons why clinicians may continue to distrust the data, or traditionally have been distrustful of data that's been brought forward either by vendors and suppliers or, supply chain themselves?
Well, clinicians are trained to analyze and interpret data to inform their decisions. And they're particularly interested in the data that has direct bearing on patient outcomes, right? So their distrust you're talking about is really based on historic experiences where the data they've received and relied on, especially coming from the supply chain, has been traditionally questionable in terms of the ways it's been collected, its accuracy, and its completeness. And if you're a clinician and you are expecting to have a certain set of medical devices and products available for you to perform a procedure, and those products are not there, or it's not the right size, or it has expired, or it's been recalled, then you have to reschedule the patient. It may actually affect how the patient is being treated. It could be a risk to the patient because sometimes there are emergencies. So the information coming from supply chain was less than perfect, let's say. And this is the reason why they have failed to trust that information, because they need that to make their own decisions.
Well, Arnold, we talked about some of the challenges, right, that we have with the data, with the systems and working together and all that stuff. But give me something to get excited about. Tell me something I'm going to go, wow, in 5, 6, 7, 8, 10 years, that maybe some advancements in technology that's really going to help the clinicians, the supply chain do a better job, be more efficient, have more information at their fingertips. Tell me, blow me away. What are we going to see?
But I think this is a problem, Hayes, because I think everybody's looking for the shiny object. And this is even more true in areas where there are big problems, because rather than facing the issue that you have today, it's easier to look in the future at a technology that may solve the problem that you don't want to address today. So this is really true of, for instance, AI and blockchain and machine learning. I've been to so many conferences where the rooms where speakers were talking about these technologies were packed, and those where the speaker was talking about a real problem, revenue cycle, or the silos in the hospitals in terms of technology, the lack of interoperability or lack of integration. Very few people. Because there are a lot of opportunities to seize today in healthcare, and mostly in the supply chain area. And I mentioned a couple of other areas that are outside, like cybersecurity and others. But those are real opportunities, and those opportunities are not being mined today. So yes, I think AI is a great technology. It's fantastic. It will change the way we behave, the way we live our lives, and it will be true in healthcare as well. The problem is, like AI, like machine learning, they both need a lot of data and reliable data to be able to answer our questions, right? So if we don't start capturing good data today to feed these new technologies, we won't be able to get the good answers we need to make good decisions in the future. So I think it goes back to, I'm sorry not to tell you there's a magic wand out there.
Yeah, you just popped my bubble here, man. Come on now. I was expecting to plug something in and just, basically do everything. So well, apparently we're not quite there.
Yeah, apparently you just say AI and everybody's happy today. So, so I can say AI, but, it's not today anyway. It's in the near future. And I think there are many more opportunities to seize in the meantime.
What can we do to leverage the technology that we do have today? And, or how can we make the data that we are utilizing better for the clinicians and making better decisions for the patients? Like if you're saying the opportunity is right here in front of us, which I believe it is, what is it that should be done? And even then, like, does somebody need to be a specialist on the team to tailor this information for the clinicians before we give it to them, to make sure that it's relevant and it lands? Because I feel like everything's moving at such a fast pace now.
Yeah, well, I think, it all comes back to the data. If you have a good source of data that is accurate, reliable, complete, standard-based, you're going to get more information that you can use to leverage your own decision making and take it in new directions, right? So I think it all comes from the ability to automate the data collection and have more visibility of the data, and the data being able to flow from one silo to the other seamlessly, and being able to really generate a lot of benefits for all of those systems connected. I think this is really where the opportunity is.
I really like that about, automating the data collection, so that you can achieve the standards, because it is that bad data in, bad data out conversation. But even tabling that, it's just not sustainable to expect that the data collection would be consistent and always captured, if we don't automate it, right? The automation is exactly how we get that standardization, isn't it?
Correct. You can't do it without a technology. And you have to understand that the supply chain is several elements. They are receiving products. There are a lot of transactions about the items. And then they are kind of entrusting clinicians with the last piece of the key element of the supply chain work, which is the usage of products and medical supplies. That's at the point of care that this documentation is happening, and it's entrusted to clinicians. Clinicians, their goal is not in life to do supply chain work, is to care for the patient and support maybe the physician, or, provide some support to other clinicians in the room. So if they're distracted by performing some supply chain tasks, they're not doing what they're paid for. They're not doing what is really improving the patient outcome or minimizing the risk to the patient. So only through automatization can you get to that element where there's a real benefit for the clinician because they can do the documentation really swiftly and accurately. It's good for them, more time to focus on their core mission. And then this information can loop back to the rest of the supply chain and help with reordering and replenishment. So I think that's the issue that we are facing, is needing to provide benefits to the clinicians so that they can participate effectively in the supply chain.
I mean, let me ask you this, Arnold. I mean, obviously, for our listeners out there that are, hospital execs, and they're listening to this and going, my goodness, there's just so many hurdles to overcome as it relates to this. It can be done, right? I mean, there are solutions out there. Maybe it's yours, maybe it's others, but some are doing this pretty effectively compared to others. Would you agree, or kind of what's your thoughts on that?
There are definitely institutions that have understood the criticality of the data, how data and the automation of the data capture following standards is critical to elevate all the system that they have. Otherwise, they're underperforming. They are not being able to share information. There's very poor trackability throughout the supply chain, poor visibility. That doesn't really help you be in command, right? So yeah, some institutions have really made some real efforts into automating the data collection using technologies for documenting, making sure that the people in charge of capturing the data can do it easily and accurately. But it's not every institution around the country.
Yeah, I think that data capture piece, especially for clinicians, has to be easy peasy. It has to be bulletproof, simple. And, a lot of that I think could be driven by UDI. Like there are a lot of initiatives out there that could really help us make some substantial improvements, things that are happening at a really high industry wide type of level to give us the format and the structure for the data sets consistently enough that a technology like that could be brought in. Because when we don't have the standardization as an industry, it's really hard to standardize or put in a solution that can capture that data without having all these complex, data sets and matching that has to be built in with that. The implementation becomes so complex. So Arnold, great job. Honestly, thanks for joining us so late at night over in France. Anything you want to add before we wrap up here?
No, I just wanted to say, to answer your question about the standards. And I think it's very important for the data to follow standards. UDI is one of them. And being consistent and rigorous is very important. I think being able to establish a real source of truth at the hospital where all the systems can have access to this data so that they really speak the same language when they're talking about a product in the ERP system and the product in the clinical documentation system. They can understand that we're talking about the same. I think that's very important for a hospital to be able to have that in place. I don't think we need someone to create it. I think you need the system. And of course, a cloud-based system is ideal because it can disseminate the information everywhere rapidly in real time, especially if it's standard-based. So I think those are critical elements to the success of implementing a supply chain technology and breaking the silos that we're talking about.
All right, Arnold. Great job today. Yeah, thanks for coming on.
You're welcome.
That was Arnold Chazal, CEO at VUEMED, talking about how to adopt technology in those supporting departments to improve operational efficiencies such as supply chain. And then what types of technologies? The kinds that help us continue to break down the silos and automate data collection so the impact or the time required by the clinicians is less and thus, more usable data, Hayes.
You're exactly right. I mean, we need to bridge the gap between all those silos, all those departments, bring it all together so our clinicians can do their job. We can have cheaper products and better outcomes. And that's the whole goal. So yeah, absolutely. It was really insightful.
All right. On behalf of Hayes and myself, thanks for listening to this episode of Power Supply.
Thank you you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.